I am a nursing major, but more importantly, I am a world traveler, I like to say that.
Hannah's two loves come together when she and 17 other Indiana State students venture south of the equator to deliver health care to small communities in Quangaje, Ecuador. The experience is all thanks to State's chapter of Timmy Global Health.
Timmy Global Health is a sustainable aid kind of program. They are in different parts of the world, and they basically bring health care to places that previously may not have had as much health care as needed.
Quangaje's landscape is not for the faint of heart. It's located in the Andes mountain range at elevations of 11 to 14,000 feet. The students, along with volunteer doctors and nurses, start the week counting and sorting supplies and medications. Large buses navigate the windy dirt roads and deliver the team to the remote communities.
A lot of the people we were seeing may have lived only 2 to 3 miles away, but because of how like the topography of the mountains and things of that nature, they'd have to walk 3 to 4 hours just to get to our clinic.
The majority of the illnesses are caused by lack of basic needs, clean water and clean food.
Even if you have all the knowledge, even if you have all the resources, if you have no health, there's nothing else you can do. So I think Timmy has a great combination between both of those, where we are educating, we are using local, or working with the local communities, with local health centers, with the local system, the local Ministry of Health, to be able to educate and outreach to a lot more patients and a lot more communities.
It really makes you aware of the level of sophistication of medicine in America versus the rest of the world, number one. Number two, it makes you also very aware about how hardy people can be, and that perhaps sometimes we don't need the high level of care that we have in the United States, that it may be overkill. So taking care of the basic healthcare needs that these people need really impresses me that we could probably devote more effort to taking care of basic healthcare needs in the States and stretch our resources farther. That's impacted me a lot.
During the week, the team treats nearly 500 patients. They refer 47 of them to follow up with specialists. Thankfully, Timmy will provide the much-needed transportation.
The people of Quangaje, they seem very, very happy. They're very tight-knit in the sense that they have very strong family connections. They all look to help each other, even if there's not necessarily blood ties. You get a very, very strong sense of community and belonging that exists between the people there.
I think my favorite part of the trip has been watching the students go from being friendly, enjoyable people on the start to being very integrated and cohesive, both within the ISU students, as well as with the interaction between the Quito medical students in here. I mean, that is really fun. And it's also fun to watch the students learn what it means to work in a team. And medicine is very much a team sport today. It is not the doctor is the king of everything. It is very much dependent upon each other. And that very clearly came through this year.
I felt that this is kind of what humanity was here for, is to help each other no matter where we come from or what we may be experiencing. Like, our job is to help our fellow brothers.
Definitely see myself continuing either with Timmy or another volunteer organization. Once I'm in med school and I get my MD, I don't think that global volunteering or local volunteering will ever stop when it comes to my medical practice.
My biggest hope is that you guys are taking away not just knowledge of, oh, I did vitals, oh, I did all this different stuff, or I had fun, but that you understand and you know that you are the future. You guys have the power, you guys have the knowledge, you guys have all of the strength necessary to actually make a change or make a contribution to anywhere you guys want to do that in the future.